The title of this talk is Healthcare at the Crossroads 2012, or A Crucial Time for Decision Making. Let us not seek the Republican answer or the Democratic answer, but the right answer. Let us accept our own responsibility for the future. Well, where do we stand now with healthcare? We have the Patient Protection and Affordable Care Act, 2,409 pages. For comparison, Medicare and Medicaid, 136 pages. The U.S. Constitution, 11 pages. The Ten Commandments, 1 page. The law was passed 3/21/10 and signed 2 days later. And here is a diagram of the law. The law has been estimated to contain increased or new federal regulatory agencies numbering approximately 170. Nobody knows for sure exactly how many agencies are involved. Notice the Secretary of Health and Human Services has significant powers over this new healthcare law. Notice down in the lower right-hand corner we have the patients, and in the lower left-hand corner the physicians. The Secretary is directly responsible to the President, as you can see from the diagram. Well, what is involved here? Is this really about health care, or is it about something else? Are 170 agencies really necessary to accomplish what was the stated goal of this law, which is to insure the uninsured? Well, it's pretty clear the law centralizes power, as you can tell from the diagram. It expands federal agencies. Many people think it fundamentally changes the relationship between the citizen and the state. The citizen is no longer the master and the state the servant, but rather the relationship is reversed. The state has control over the citizen. This is a highly government-centered solution, as you can tell by all the agencies. The big question is, really, is this law good for patients, or is it good for government? At the time the bill was being debated, Nancy Pelosi, seen here in the picture, said that we have to pass the bill so you can find out what's in it. Well, when you try reading the bill, it's extremely difficult to understand. It's doubtful that anybody could understand it, even if they did read it. And it's doubtful that any legislator who voted for it read the whole thing. Also doubtful that the Supreme Court read it when they passed judgment on it. This law refers to all sorts of other sections in the federal code, as you can tell by reading this sample of the law here. It's very complex. Well, some brave souls have gone through the law, and what they've been able to determine are several things. It appears that there are approximately $715 billion in cuts to the Medicare program for patients over 65. This will significantly impact elderly patients. Much of this cutting is due to radically reduced reimbursement for physicians, which will most likely make it difficult to find a physician if you're in the 65 and over age group. Also, one of the centerpieces of the law is the so-called Independent Payment Advisory Board, seen here in the orange circle. The goal of this really is rationing of health care because of the required $715 billion in cuts. The panel members on this board will be selected without any say from voters or patients, and therefore be essentially unreachable by the voters, even if the results of their decisions are extremely unpopular. Here's an example of what might happen when this rationing goes into full effect. There's a condition called trisomy 18, a birth defect, with many visible problems, including low birth weight, hand deformities, foot deformities, head deformities, heart and kidney malformations, mental retardation. If you look at a textbook of pediatrics, the description of the disease is very short, but the bottom line is that 95% of cases are lethal in the first year. If you're on this IPAB, one of the representatives on the board, you're obviously not going to spend any money for a child born with this birth defect because most of them, vast majority of them, die in less than a year. However, here is an example of somebody with this condition. And in the old system, this child was covered by insurance. The insurance company honored their contract and repaired the defect in his heart, and now he's doing well. He's past age 4. In the new system, once the IPAB really gets going, this child will not get care because it's just not worthwhile. If you look at the odds, 95% of these children die after 1 year or before 1 year. I happen to know this child intimately because he's my son. Here he is with his other 5 siblings, and he's doing fine. In the old system, he does fine. In the new system, no money for him. Other problems are abortion. The Hyde Amendment in '76 prevented federal funding of abortion. During the debate of the Affordable Care Act, House members led by Stupak withheld their votes for the law because of the abortion funding. President Obama promised an executive order prohibiting abortion, so Stupak changed and voted for the new law, achieving its passage. However, President Obama did not keep the promise regarding abortion, and now abortions are federally funded. This applies mainly to Medicaid patients.